Debate tonight continues for others about whether or not to get the shot in the first place. We have seen that play out at workplaces across the country. Employees faced with two choices: get vaccinated or risk losing your job. Well, now it is happening on the front lines of the pandemic at hospitals that are already crippled by COVID cases. North Carolina's largest healthcare provider, for example, suspending hundreds of its employees for not getting vaccinated. But they are not alone in their decision not to get the shot. About 74 million Americans are eligible for the vaccine but have chosen not to get it. And this is all coming at a time when yet another COVID variant is spreading rapidly across the country, and its latest target, a nursing home in Kentucky. NewsNation's Janelle Fort is live for us in Atlanta tonight with the very latest. Janelle.
Well, Marnie, this new mutation is called the R1 variant, and it's responsible for that outbreak at that Kentucky nursing home. 45 patients and staff there, many who were fully vaccinated, came down with it. Now, it's unclear if this new strain is going to fizzle out or if it's going to become the dominant strain like what we saw with the Delta variant. But this all comes as health experts are warning that until more people are vaccinated, we're going to keep seeing these mutations of the COVID-19 virus pop up.
In the latest vaccine push, hospital systems putting healthcare workers on deadline to roll up their sleeves or find a new job. This week in North Carolina, Novant Health suspended 1.4% of its workforce for not complying with its mandatory vaccination policy. Novant gave its workers until September 15th to get at least the first dose of the vaccine or to apply for and receive a medical or religious exemption. Nearly 400 workers didn't do either. They now have a 5-day unpaid grace period to comply or lose their job. In a statement, the healthcare provider said, quote, team members who have started a 2-dose vaccine series will now have until October 15th to get their second dose.
I don't think any state, North Carolina or any other, can afford to lose this many workforce.
Tatiana Kelly is a VP at the North Carolina Healthcare Association. She says the industry was already dealing with the worker shortage, and it's only been exacerbated by the pandemic.
It's going to make things worse. It's going to make things tougher. But it's also incredibly important for us to vaccinate that workforce, because this affects patient safety and affects the health and well-being of our patients.
North Carolina isn't alone. In Texas, 153 employees at Houston Methodist either resigned or were let go for not meeting the vaccine requirement there. In Indiana, at least 125 part-time employees at Indiana University Health System lost their jobs for not getting the shots. And in New York, there's a legal battle over the state's healthcare worker vaccine mandate. It's a dilemma that could play out across all sectors and in other healthcare places. President Biden announced vaccine rules for federal workers and large employers earlier this month, and also said he would require the nearly 20 million healthcare workers at facilities receiving funds from Medicare and Medicaid to be fully vaccinated.
We need to go big, and we need to do our part. Governments, the private sector, civil society, leaders, philanthropists. This is an all-hands-on-deck crisis. And the good news is we know how to beat this pandemic. Vaccines, public health measures, and collective action.
And Marnie, these new requirements from the Biden administration could apply to upwards of 100 million Americans.
Janelle, live for us in Atlanta tonight. Janelle, thank you.